because sometimes this frame it sees through from inside, and then the problem is the outside color, which is really bad. This is FP1 style, which is there's no pink. Okay, but it's constantly we forget is the cracking, because this is a temporary, which is doctor fabricated in their office side, and then they trying to give a little bit more segment, trying to make the individual looking. The problem is the strength is not enough. So I see this FP1 as a cracking easily. So in order to avoid those things, we need some plan. So you have to take a look at it. First, we have to diagnose what is the good solution, good method for that. So I made so many FP1, which is great. So there's no pink, and then they're trying to make the convex underneath, and then make individual restoration. There's no pink down there. So it looks like the teeth goes to the socket. So which is a great concept. So my problem is longevity. It's easily cracking, and then patient is not happy for that. For this case, from the all the way from the Hawaii, his name is Dr. Eric Wong. I think he's Maui. So you can go that young genius prosthodontist. You can go get the good implant size. So he and I discussed together, and then we fabricated about the 7 implants, and then we have to make the frame underneath. Okay, the frame is very sophisticated. We need another design beside the ExoCAD. Is a much better design, and then I can give them the better solution not only underneath, and then also is a passover insertion between the teeth from frame, and this is a finer. So outside looks same. Okay, outside looks identically same, but inside is hollow. You know why? Because we have a frame. So when we cement it, before they go to drop it, and then we all connect together, so which is more patient can get strength. This is more makes sense, right? But we have to really careful about the not only fitting, and then cementation is very important too. So we have to make some good indentation. Oh, not only that, I'm really worried about the finer color, because sometimes this frame it sees through from inside, and then make the problem is the outside color, which is really bad. So we have to measure it how much room inside, which is 4, 5, 6 millimeters should be okay. 5 millimeter. So we did not put anything about opaque here. Okay, so a lot of people is asking is what kind of opaque here. I using ides dentalis, which is they're from the Mexico, that we put the sandblasted and then curing, prime and curing, and then we put the light opaque 2-3 times, and you need a good curing machine. Sometimes we don't have to over 100%, depends on the case. If it is lower like this, so I have to cover everything, because when patients open the mouth and they see through from back side, so we have to cover it. However, this case, upper cannot see, so we did not put anything, except we will going to make the retention. By the way, the cementation things, we made a lot of videotapes, previous video, so you can take a look at it step by step, so you can go from there. And also you can join my Patreon member or YouTube membership, so you can see that one too. So not only that, we put the opaque underneath. So before we sinter, we add with the white color underneath, white opaque. Okay, so we sinter. This is from the B&D Dental Technology. So they gave us this great the opacity and the translucency and then strength, is so we can make this finer contour and direction. So this is tissue the doctor created, and I have to make the perfect as possible. And then this is the frame design goes down there. You see we just close the in between the gap. So underneath, so this is trying to make the straight, flat and convex, and then go down there, okay? This is the patient internally they can get. And not only this is top, okay, so we just add it like this. So patient we can get like this. Like this here. You see the room, everything? Okay. Now this one is patient can get, and the lower there we're going to do it again. So we're trying to make the ideal as possible from doctor made the prototypes. So that's the final FP1 style, no pink, and then make the frame design because we have to make individual looking, because in between the teeth I have to make this more segment in between the teeth and make individual, okay? Therefore, here is lack of room, here is lack of room possible. So we're trying to add a little bit more thicker as much as possible, but sometimes we have a limitation. Okay, so that's why we're using this. Yes, you can do with the chrome cobalt. Chrome cobalt is a little bit more better longevity. Okay, so this is light titanium, which is still work fine. And then here, let's go down, just like drop it. That's patient can get. Now, so we will going to do the sandblasted, and then we're going to cementing soon, and then we will going to deliver it to the all the way Hawaii from Chicago. So this is another SYTON tie direct we call another option compared to regular full mouth zirconia, which is they made it all the time. The regular zirconia is fine, but I did not do it because this one I have to make deeper, just like what doctor did it. And why they make segment? They want to make natural as possible. That's the reason. So we have to utilize our experience, expertise it. That's why I give them another option. Of course, this is another extra money, but this one is you can get a good longevity. Okay, so I don't want to get break-in, I don't want to get discomfort, but it's still slim, still thin, so we can give them the better prosthetic. A lot of people asking compared to SYTON 7-star individual product this. SYTON 7-star is a little bit limitation to make FP1 style with the individual frame design, so we make all connected, but aesthetic will be same and the beautiful color, shape and contour. Thanks for watching my channels. I'm trying to make the good video as much as possible, but maybe you know that running the big business here is really challenging every day, but I can make the better video, and then I'm trying to give you the good solution, which is a lot of dentists don't know because they cannot do the big case. Some dentists do, even though some dentists can do, but they don't know the prosthetic option, because we've been doing a lot of full mouth cases here daily basis. So that's why I know exactly what the final plan and solution. That's why I give you the best solution as much as possible. But this is what I'm talking about, and you can see even put together like this. You can see this beautiful aesthetics, right? As much as possible. That's our expertise. You can feel free to compare any other dental laboratory. And so my goal is aesthetic, which is patient goals. My aesthetic is longevity. And second goal is hygiene. And third one is aesthetic. This one is I can deliver patient, not me, not dentist, so you can get burnish in between the teeth. So you can get an excellent prosthetic with the still thin, and doctor can make this good. And the patient's eye, so there's no pink, like I said. There's another amazing case though.